Hello, I'm Chetlen Crossnoe, family medicine physician here at Grace Clinic, and this is the second in our series of talking about gastroesophageal reflux disease, gastritis, and peptic ulcer disease. In the first lecture, I kind of talked about the causes of these problems and the symptoms that may occur from them. In this talk, we're going to talk about the treatment of these illnesses. Like I said last time, I hope you get some good information out of this, but if you think you have these problems, please be sure to see your physician. A number of these illnesses have overlapping symptoms with a number of other dangerous things, such as heart disease. So anyway, let's get started. Let me start with a bit of a historical perspective. As I mentioned last time, this is a very common problem. It affects most people at some point in their lives. But prior to a number of years ago, we didn't have the greatest therapy for this. The first drug that was available to decrease acid production was Tagamet or cimetidine, and that was in the late 1970s. It was so important. It was the first blockbuster drug to make more than $1 billion in sales. So that gives you an idea of how important this was. Prior to that, there is an important surgical procedure called the Nissen fundoplication, which goes back to about the 1950s. And then prior to that, there was really nothing that people could do about problems like this other than changing their diet or taking antacids. Let me talk real quick about antacids. Humans have known about certain plants and certain substances that we could take to help with indigestion for thousands of years. An antacid is a chemical or a substance that is chemically basic that when ingested interacts with the acid here to neutralize it. Antacids can help a lot. They can help make symptoms much improved very quickly. But the problem is if you use them a lot, eventually the body kind of starts upregulating the amount of acid, and you take it in that much base can be a problem in and of itself as well. So prior to the modern day, there was really not a lot that could be done, and a lot of pain and suffering from this, and even mortality from perforated ulcers was a lot more common than it is today. Let me also say, just on more of a personal note, as a physician, treating these problems is really very satisfying. You know, a lot of what we do in family medicine either is things that you just kind of have to wait to get better, or they're things that we never really know if it helps. You don't know about the heart attack that didn't happen, for example. But I've had a lot of patients come in who maybe have been hurting with something like this for weeks or months or even longer, and we can give them medication and make them feel better really, really quick, and that's very satisfying. So this is an area that modern medicine has really helped out a lot. So what is the treatment? For the most part, by the way, the treatment of these three problems is very similar, decreasing the amount of acid. So I'm going to talk about them all together. When we get to procedures, then that's a little bit different. They mostly have to do with reflux specifically, but in general, they're all the same thing. So to treat these problems, we use what's called step therapy. Specifically, there are 7 steps. So the first step, the basis of treatment, like with lots of things in primary care, is lifestyle change. What that means is we need to think about what we're eating. We need to think about, and that's the spicy foods, alcohol, caffeine, things that we know irritate and cause more acid secretion. Sometimes it's things like trying not to eat within a few hours of bedtime, but really ultimately we have to be thinking about lifestyle change. Also weight loss, by the way. Overweightness and obesity can exacerbate reflux. So lifestyle is the beginning. And then is antacids, which we kind of already talked about. In the modern day, we use things mostly like Tums and Rolaids and Mylanta. And like I said, they can help a lot, but we can't use them a whole lot. These are also beneficial sometimes for diagnosis. If you're having abdominal pain, you're not exactly sure why, and you take a Tums and you feel a whole lot better, then you have something having to do with acid. So that can be beneficial in that way. But if that's not enough, or we find ourselves taking a lot of antacids, then it's time to move to an acid suppressing medicine. And the first of those is over-the-counter H2 blockers. The medicine I mentioned earlier, cimetidine or Tagamet, was the first of the H2 blockers. It's pretty much been replaced in modern day by Pepcid, which is famotidine, and Zantac, which is ranitidine, and because these medicines they last longer and they interact with other medications less. And note that the H here stands for histamine. These are actually kinds of antihistamines. They're H1 blockers are the ones we think of as antihistamines, like you take for runny nose, for allergies, things like Benadryl, which is diphenhydramine, and others. The H2 blockers are ones that work really specifically on the stomach. And so that can be really beneficial. Then if that doesn't work or it's not working well enough, then we move on to the proton pump inhibitors or over-the-counter PPIs. The proton pump inhibitors are a really important class of medications that are very powerful. They're very powerful in decreasing acid secretion in the stomach. If we take enough proton pump inhibitor, we can pretty much cut off almost any acid secretion or almost any amount of acid secretion unless there's something really strange going on. These are the medicines like Prilosec, Nexium, and Prevacid, which are omeprazole, esomeprazole, and lansoprazole. If you'll notice, all of them, the generics end in prazole. That's pretty reliable. If you hear a medicine that the generic it ends in prazole, it's probably a proton pump inhibitor. So that's why I tell my patients to just look for prazoles. If the over-the-counter dose doesn't work, then we just use more PPI, which is a prescription dose, which for the most part, these are all available as prescriptions as well, and they're mostly just twice what they're available as over-the-counter. There are some proton pump inhibitors that are only available by prescription, and that includes Dexilent and Acifex. And I use a lot of pantoprazole, which was Protonix. Now, one thing to mention in here is that these proton pump inhibitors are so strong that we basically completely get rid of the amount of the acid in the stomach for a while. Is that really a good idea? We're going to come back to that more in a few minutes, but just keep that in mind. So if our prescription proton pump inhibitors don't work, then we use even more PPI. It's like the cowbell. We just need more and more of it, right? So sometimes we start doing the prescription PPIs, but now we'll do them twice a day, for example. So taking Nexium twice a day, and that's kind of as much as we use, and that will cut down, that will stop acid secretion on almost anybody. Then past that, or if you find yourself stuck here and having to do this long term, it's really time to start thinking about procedures. And so the last step here is procedures. One of my colleagues, Dr. Cummins, has a video talking about some procedures, and he's a specialist in this. And I'm not going to go into that a whole lot, except to say that certainly if you find that you're having to stay on these medications a lot, it's probably actually a better thing in the long term to go ahead and undergo some kind of procedure or surgery to help with that than to be on these medications long term. So one reason to think about this as step therapy is its important part is that we can go up and down the steps as we need to, depending on symptoms. Acid disease tends to be kind of an up and down kind of thing. It'll be really bad for a week or two, and then it kind of goes away, and then it'll be bad again. And so rather than staying stuck on one step for a long period of time, it's better to step down when things are better and then step back up when we need to. So why would it be bad to be on these for a long period of time? And let's talk about that. A couple of things. First of all, the proton pump inhibitors are so strong acid reducers that basically it gets rid of all the acid from the stomach. Well, the body's not stupid. It feels that this is going on and tries to make more acid. So it upregulates the amount of acid production by trying to make more cells to secrete acid. Now, so what that means is then if you're on these for a long period of time and then you stop, then you're going to have a rebound effect that's worse than you started. You're going to have worse acid reflux than you started, or acid disease than initially. So that's one reason that when you have been on these for a long time, it's better to step down rather than just immediately stop. Another thing is, well, we do have that acid in there for a reason, like we mentioned. And there is at least some concern, and this is still kind of up in the air, but there's some concern that maybe suppressing acid for a long period of time is not good for us in a couple of ways. First of all, we're not getting that defense from the acid, and so there's maybe an increased risk of certain kinds of infections because of that. Also, that changes the chemical environment for digestion, and so there's some concern that maybe certain minerals are not absorbed as well when we have no acid for a long period of time. Now, all of those problems, that doesn't apply to short-term use. All the over-the-counter ones and really even the prescription ones are indicated for up to 2 weeks. Doing it for 2 weeks is not going to cause any of those kinds of problems. But many people, even many of my patients, are on them for a long period of time because of symptoms, and that can possibly be a problem. Recently, it's even been in the news because there's been an association between long-term use of proton pump inhibitors and an increased death rate. Now, I'm a little bit skeptical of that. Like a lot of things that we see in medical news, one thing to keep in mind is that when you see reports like this, is that association does not imply causation. Nothing in the research at this point has said that proton pump inhibitors cause early death. That's still to be determined. It may be instead the case that people who are more ill are more likely to need proton pump inhibitors. So anyway, that's a concern, but it just reinforces that it is important to step down the step therapy when we can in order to avoid problems. So if you do have to be on a acid reducer for a long period of time, a lot of times it's better to do an H2 blocker. They are not quite as strong. They allow some acid to be created, and so that may be a better long-term solution. And so there's one more thing we need to talk about in terms of treatment of this, and this is our friend H. pylori down here, the bacteria that can lead to ulcers. Whenever somebody has these problems, they need to be evaluated for H. pylori, for Helicobacter pylori. There are several tests that are available for that. There is a blood test, which is very easy to do, but it's not the most reliable thing in the world. There's also a breath test and a stool antigen test. And then really, if you do end up getting an endoscopy for some reason, they take a biopsy and look for the organism. So that's really the main way to find it. If a person does have H. pylori, then there are very effective eradication regimens, which usually involve a PPI plus an antibiotic or a few antibiotics for a few weeks to get rid of that. So that's another important part of that. So that is the treatment of reflux, gastritis, and peptic ulcer disease. I hope you've gotten some good information. Thank you.